There is a war waging between governments and tobacco companies, with society caught in the crossfire. Governments have aimed new laws against tobacco companies and smokers, such as increased taxes, plain packaging and public smoking bans. Tobacco companies have urged smokers to fight back for their right to have the choice to smoke. But do smokers feel that they have a choice, or are they victims of their addiction? Do governments have the right to regulate people's lifestyle choices, or is the health of society more important than people's freedom of choice? What do you think of the government's actions on smoking, such as plain packaging and increased taxes?
I don't think it's applicable at all. I've been selling cigarettes. I've always worked in places where I sold cigarettes. I think people will go without food before they will go without cigarettes, or their children will go without things before they will go without cigarettes.
I think if people want to smoke, they're going to smoke. They'll always find the money to buy the cigarettes somewhere.
Smokers pretty much keep them to themselves, so I don't really think that there should be real taxes on them. And if they keep encouraging people to stop smoking, then they're making their money from smokers, so they can't really complain about it. So
we spoke to Rachel Hull of the Cancer Council Queensland to get some information and views on smoking. What are the known risk factors for cancer?
We know that many different things cause different types of cancer, so certainly we're talking about tobacco, and we know that that causes lung cancer certainly, but also things like mouth and throat cancer. And smoking is also linked to cancer of the pancreas, cancer of the kidney, and many other types of cancers that I don't have time to mention. Also, being in Queensland, we are the skin cancer capital of the world, so we know that overexposure to the sun, to the ultraviolet radiation from the sun, causes skin cancer. And research is becoming stronger that things like alcohol consumption, not having a healthy diet, being obese and not being physically active are linked to bowel cancer and other types of lifestyle related cancers like stomach cancer, for example.
How many people die annually due to tobacco related diseases?
Well, the figures are really quite alarming. In Australia every year about 15,000 people die due to tobacco-related diseases. Things like cancer, of course, heart disease, stroke, other lung problems, many different types of diseases are linked to smoking.
We came to the Royal Brisbane Hospital to speak to Glenys O'Grady, registered nurse in cardiology, to ask some questions about smoking as a health professional. So how are you involved in the medical field?
I'm a registered nurse. I've worked for the last 10 years at a cardiac specialist hospital in the cardiology ward.
Being in a cardiology ward, do you see many people come through with smoke-related illnesses?
Yes. Of the patients admitted to the cardiology ward, a lot of them have smoke-related illnesses. Smoking is one of the cardiac risk factors, along with obesity, hypertension, high cholesterol, stress-related cardiac factors as well.
Have government health laws influenced smokers?
Sarah, I think they have. The latest Queensland Health Report put out in October 2010 called The Health of Queenslanders states that the smoking rates have declined by 3.5% per year between 2001 and 2010.
How many of the patients that you have seen are or have been smokers?
Sarah, I'd have to say my best estimate would be approximately half of the patients admitted to the cardiology ward. One of the questions we ask on admission is, are you currently a smoker? Or have you been a smoker? And of those people that are currently smoking, we offer them a quit smoking program.
There's no doubt that smoking is related to many health risks, but how does that compare to other lifestyle choices, such as obesity, alcoholism and sun exposure? So, can people choose their lifestyle, or are the habits set in stone?